Welcome to all Caribbean entrepreneurs. If you've been ready and waiting to take your business digital and get paid online while you sip something strong on the beach, this podcast is for you. We'll hear from the Caribbean's finest entrepreneurs on topics like e-commerce, business development, brand building, social media, their wins and failures. This is the only place in the region helping you navigate the digital age from the Caribbean's perspective. This is Digipreneur FM. And now, let's give it up for the Digiboss himself, Mr. Karan Rose.
Thank you to everybody tuning in to another episode of the Digipreneur FM podcast. And as usual, it is your boy, Mr. Rose. DJ, you gotta fade us all the way out because we gotta talk to the people. It is Tuesday, June 10th, 2025, and this is episode number 192. How are you lovely ladies and gentlemen across the world that's a part of the Digipreneur family? How are y'all doing today? My goodness. Let me just do a quick roll call. Let me see who we have tapping into the podcast this month. Shout outs to the United States. We got the U.S. in the building checking out the podcast. Trinidad and Tobago, Canada, Bahamas, Guyana, Jamaica, St. Vincent, St. Kitts. It's amazing to see Thailand is up there. We got people in Thailand listening to the podcast now. The Dominican Republic, St. Lucia. We got Malaysia in the building. Our neighbor, well, at least my neighbor here in Thailand. The UK, Ireland, Netherlands, Barbados, France, Ghana, Panama, Poland, Qatar, Taiwan, and BVI, the British Virgin Islands. I like to see where people are in the world that are consuming the podcast, because it's always a great reminder to put yourself out there, to get your thoughts out there, to get your content out there, because you have no idea who in the world needs the information that you have, that you possess. And when you put your information out there, when you share your thoughts and you share your ideas, you have no idea where that content that you've put out, you have no idea where it's going to reach. And your content is going to reach into doors, into companies' boardrooms. It's going to reach into countries that you've never visited, that you've never stepped foot in. Content is going to put you in rooms that you can't access right now, that you probably would have never been able to access. So get your content out there. The majority of these countries I have not gone to. You know what I mean? However, there are people in these countries listening to the Digipreneur FM podcast, right? So that's just your gentle reminder. We're halfway through the year. If you have still been stuck on creating content, get your content out there. Get your content out there. Find the medium and the platform that works best for you, that you can be consistent with, and start there. And you know what? And today's episode, right? Today's episode is an interview that we did with Dr. Shenilee Hazell from Smile In, right? And we were talking, the conversation was about how your smile is impacting your business. And it was a really, really powerful conversation. And again, anytime I have amazing conversations over on Digital World, there are those select ones I absolutely want to bring over to the Digipreneur FM family, because I know you would greatly benefit from the conversations. And then sometimes too, not everybody can listen to the show live. We do actually have the Freedom 106.5. We have a podcast over on that platform. So if you actually check out Freedom 106.5 website, all of the on-air talent has their shows. All of the content is posted there. And like I said, when we have some really, really amazing when we have some amazing conversations and interviews, that I feel like, you know what, this is something I want to share with the Digipreneur FM family. You already know we're bringing it over here. This conversation with Dr. Shenilee Hazell is one that you really want to pay attention to, because guess what? One of the reasons that pops up a lot as to why people don't create content is because of their smile. You have a lot of people that are not willing to get on camera because of their smile. And we don't even realize how much our smile impacts things like our confidence. It impacts whether we feel like, you know, we want to be able to put ourselves out there. When we're not confident, we don't show up in the boardroom. We don't show up in the meetings. We don't smile the way that we would like to smile. Right? This conversation with Dr. Shenilee, we dive in deep on the impact of your smile and how it impacts not just business, but also your professional, your corporate life, and moving up the corporate ladder. So again, I thought it was really, really powerful. We definitely wanted to have this conversation shared with you over in the Digipreneur FM family. So don't forget, every single Friday, 12 p.m. to 3 p.m., you can listen to The Digital World. That's my show over on Freedom 106.5. Link is in the show notes. If you're not in Trinidad and you want to listen in live, happens 12 p.m. to 3 p.m. AS Atlantic Standard Time. So whatever time zone that is for you in your country. But then guess what? We also, I'm gonna drop the link in the show notes so that you can check out the replays, because all the shows will be over there, but select ones will come over to the Digipreneur FM family. So if you love the content, great. Check it out on the Freedom 106.5 website. All right. That being said, let's bring in the conversation with Dr. Shenilee Hazell of Smile In.
The best insight, instant feedback, accountability. The all-new Talk Radio Freedom 106.5.
We always have some amazing guests and amazing conversations. And this particular conversation is one that I think a lot of us think about, but we don't actually speak out loud about. And again, it's one of those things where it's costing us and we just don't realize it. So we are bringing on the one and only Dr. Shenilee Hazell, who is the principal and lead cosmetic dentist at Smile In Dental, located in St. James. She has over 18 years of experience in dentistry. Dr. Hazell is renowned for her dedication to delivering high-quality patient care and world-class dental services. She's not only a skilled practitioner, but she's also a pioneer in the field. She is recognized as the airway dentist and multi-award-winning Invisalign provider, having held the title of top Invisalign dentist in the Caribbean for the past 3 consecutive years. So in today's conversation, we're going to be delving into the profound impact that your smile has on both your professional and personal life. And we're going to explore oral hygiene, how oral hygiene influences business opportunities, career advancement, overall health. Let's be real. You see people in the office, they might smile, and you say, huh. And you might not say it, but your face doesn't lie. And we make these judgments. But how many things don't go our way? Think about job interviews. You thought you had it. You had all the qualifications. You met all the experience, everything you need. What was it that you didn't get the job? Well, guess what? There's a large percentage of employers, 70% of employers that were coming out of a McKinsey report said that they don't hire people. There's a 70% chance that they don't hire people because of bad oral hygiene. That's huge. So anyways, enough of me rambling. We are bringing Mrs. Dr. Shenilee Hazell to the program. Shenilee, how are you doing today?
I am very well. Thank you so much for having me. I always love our conversations, and I'm very honored to be a part of this conversation.
Yes. And I mean, it's a thing, it's something I think we all keep to ourselves.
Yeah.
But we judge. Somebody smiles and there's always that initial judgment. What is it about that smile?
So we just 3 to 5 seconds of meeting someone, that's your opportunity where we all do it. We make a judgment and we notice two things. We notice the eyes and we notice the smile. And the smile is a powerful tool from a connection point of view to have an impact, to make a real connection. That's where we send a signal that, hey, you can trust me. I look after myself. I am healthy. I am clean, and I care about how I look. So it's one of those things where, I mean, it's not the nicest thing to say that, yes, we do judge, but yeah, that happens throughout life. It happens in the career space. It happens in the dating space. It happens everywhere. It happens throughout our lives. Even us as consumers, if it is someone is selling us something, we do look at them. We look at how they present themselves. And it's an important thing. I think this is an important discussion because your smile, essentially, you hear it. It's your logo, it's your currency, it's how you present yourself to the world. So it's important. And this is why I love doing what I do, because we have the opportunity to really have a real impact on someone's trajectory, on someone's confidence, on how they feel about themselves when they look in the mirror. So
Absolutely. And you know what? Listen to you talk, right? Listen to you talk. I had made a post yesterday, and my mom called me out on it, right?
Right.
Random. So here the situation. It was still a tech conversation, but here the caption, right?
Right.
I go across the street and I have a laundry lady. So
right.
I could either wash my own clothes or pay a little extra, and I just give everything to her. She washes, she folds it, she irons, she packages everything, and then she gives it back to you all packaged up. So I went to collect my laundry, and I just happened to notice on her wall, she has a QR code. And I'm like, wait a minute. Are you telling me I've been going to the ATM and taking out cash when I could have paid this woman with a QR code, right? So I took a picture of everything. Now, to make the picture stick and the caption really jump out, my laundry lady's in her 60s. She's almost 70, right? She's like 60, I think she's 67, right?
Yeah.
But in the caption, I was like, just went to collect my laundry. I just realized that my laundry lady, who is 67 years old and has 4 teeth in her mouth, is accepting a QR code for digital payments, right? And I said it to make the point that this is not somebody you even remotely think knows anything about tech. However, I can pay her. So my mom was like, oh, Geed, well, why'd you have to mention her teeth? And I was like, to paint the picture so you know.
Yeah.
And so just listening to you, yes, your smile is your logo. We think about it because she has 4 teeth and it sticks up.
Correct. Well, here's the thing. Like, you remember that so much that we're discussing it right now, right? And you are just a client. So you imagine, and that's one of the things that I don't think we realize. It sticks in our head because this is the picture that we grasp, this is what we go home with in our memories. And when we're able to, I think, make that decision to improve, and it's far more than the cosmetic. The cosmetic is the world that we live in today. We see someone, we have 3 to 5 seconds to judge their face, and we come to a conclusion whether we're going to trust this person, whether we like this person, whether we're going to believe the words that are coming out of their mouth, and that is really based on that split-second decision, right? And for me, like, it's also more, being a dental health professional, it is also more than that, because it's also, do you brush your teeth and floss your teeth? Do you have halitosis? You know what I mean? It's really just how much effort and care are you putting into your health? And the mouth is a window to your general health.
Oh, yes, yeah.
How much effort are you putting into looking after it? Not just brushing your teeth, flossing, actually preserving it. So if you notice a problem, are you giving that priority? If it is, you think you can improve it, are you giving that priority? Are you looking after yourself? It's part of self-care, but it's also discipline as well.
which is a perfect segue because my first question of this discussion is, you're seeing patients every single day. What are some of the emotional reasons that people, come to you with and tell you about for wanting to fix their teeth?
So actually, the biggest thing that I hear is that they have always wanted to do it. They were never in a financial position to do it. But now that they are, improved in their career or a little bit older or priority shifts, that they want to do this and they want to do it for themselves. I have some people that want to do it for, let's say they have a wedding coming up and they want their wedding pictures to look as good as possible. I have people who come in to fix their teeth because they have a milestone coming up. They're turning 30, 40, 50. I see people who are in their 80s that want to fix their teeth because they've always wanted to do it. But it's usually a personal decision, and it's actually one that has different layers, right? So you have to make that decision. Then you have to make a phone call to go see a dentist. Then you have to turn up to the appointment. Then when you turn up to the appointment, you have to be open to understanding how you can progress and how you can achieve success. And then after that, then you have to execute it. So you have to then go through with whatever treatment plan your dentist is coming up with in order to help you. So it's a series of intentional decisions in order to get from point A to point B. And yeah, it's always really, really incredible when people come with their stories of why now, why they decided now to fix it. And it's something that I never ever take for granted, being chosen to do that, because it's like, I'm part of this really important journey of transformation, of improving confidence, of improving their dental health, and just improving their cosmetic smile.
Have you seen clients complete a program with you, a treatment, and break down in tears?
Oh yeah, for sure. And
talk to us about that.
Some of those things are not necessarily like a long-term journey. Sometimes it's a short-term thing. Sometimes we do this one thing that they have always been bothered about whenever they look in the mirror. And then at the end of the treatment, we hand them the mirror. And of course, they get emotional. They break down. They cry. Some people, men, women, it's because it means a lot to them. And when it bothers you to the fact that you actually do something about it, when it's done, it means something. For my Invisalign patients or patients that go through any long-term cosmetic improvement, it is a journey. It does take time. And there's times when it feels like, okay, are we going to get there today, tomorrow? There's times when it actually takes time to get there. And at the end, when I show them their before pictures, there is a constant theme where people won't even look at their pictures before. I have someone that I was talking to actually last week, and I was like, I wanted to know if you had any pictures from before, because I'm putting together like your story. And he was like, I deleted all those pictures. I don't identify with that person before. Yeah. So that actually happens as well. People don't usually want to even see the pictures that we have of what it used to look like, because they're so happy and they're so content and they're so confident in their new self. And one of the other things that I see is when we start to change the smile, actually it filters out into other aspects of their being. So they tend to look after how they appear more. So they start dressing with a little bit more intention.
a little razzle dazzle.
Yeah, the hair changes. They start looking after I have people that some of them start going to the gym and start working out. So it actually infiltrates all levels of your presentation, and it's really amazing to see,
When you are, at some point, all of us have been out of shape, we consider out of shape, right?
Right.
And we look in the mirror and we just rip our body apart, right? What are some of the negative thoughts that people say to themselves when they're looking at a smile that they don't like? And what are some of those positive things that as soon as that treatment has finished, what are some of those things that people say?
Okay, so one of the things that I hear a lot is that as we get older, we age. It happens. Men, women. I feel like sometimes women are a little bit overly critical, but we don't look the same that we used to when we were a teenager or 20s, right? And actually, if it is we don't do certain things with our teeth and our smile, that ages as well. And what people see is they actually see that progress of that aging process. They see it in their smile and they're like, this is not me. This is not what I'm used to. And they've noticed it slowly. Sometimes it's over 5 years. Sometimes it's over 10 years. Sometimes it's a simple thing as the color or the shade of their teeth. And one of the positive things that happens at the end is that they feel a lot better. And when they smile, they don't have to think about how they need to smile, how they need to position their face or their hand if they're blocking it. They can smile comfortably, confidently. It's like almost like a freeness that they have. And some of my clients, some of my patients, I speak to them after and, we have a little discourse where they share, how grateful they are that they can actually just be free and smile however they want to. One of the things I see, though, which is incredible, is when they smile before, because I always do a facial smile pic, and they smile, and it's like smile. And when I go to prompt to smile, a lot of them are like, I don't even know how to smile. I don't really smile. I don't smile with my teeth. I don't know how to do it. I could practice, but it's going to look weird because I'm not used to doing it. And then after, when it comes to, let's say, 6 months later or 1 year later or a year and a half later, whatever their treatment time is, after they smile, they're like, they don't think about it. And one of the things that I see in the pictures is I can see it in their eyes, because one of the things with a genuine smile is that the eyes actually smile as well. If I'm smiling right now and I'm really like laughing, your eyes chunk up. Because it's real emotion. And when you actually show real smiles, that's actually, again, that's how you connect with people. That's how humans connect with each other, because that's the sign of happiness. That's the sign of content. That's the sign of, hey, there's a safe space, You
said so much there, right? And one thing that you said was that, when people are not confident about their smile, they do all these little things, and one of those things is they cover their mouth when they're smiling and whatnot, right?
Or talking.
And it got me, or talking, right? And it got me thinking, I can't even pronounce the thing that I had in my own mouth. And when that thing blew up like a balloon, I didn't smile for weeks. All of a sudden, my gums were done. I was like,
right. Okay, yes.
My hand was covering my mouth.
Yes.
I was, and because it was, and then what made it worse?
This is when you came to see me, right? This is
this exact time. Yeah, this exact time, right?
I literally looked at it and I was like, this is what it is.
Yeah. You know what made it worse? What made it worse was that I had pictures at an event, right? And it's an event photo, post it, caption, blah, blah, blah. And somebody messaged me and like, is that your gums?
Yeah.
Like, because you saw the whole thing in the photo. And once they brought it up, I was like, oh my God, I'm not taking a photo again.
Yeah. No, I get it.
Right?
I get it.
So how do these insecurities show up in everyday life?
I think it shows up just in that inability to have a plain conversation and not have in the brain, okay, I need to think about how I'm doing this. You know what I mean?
I'm gonna laugh now. Let me cover.
It's that pure confidence. It's that not needing to think about how to do it, And I will say that, we do live in a space where we can throw a filter on it and we can put makeup on, we can do whatever we want to. There are kind of hacks, but actually getting it fixed for real is the hack. It is the thing that's going to get you to that next level, Because, I see it too. I have patients who are I have patients who are in the corporate sales world. I have patients who speak on camera in Zoom meetings.
Oh.
And especially if you're meeting someone, I mean, for me, like I speak to people from all walks of life as patients, but then in my international dental world, I speak to people from in different countries at different time zones. And when you meet someone, especially on a screen when it's not in person, it's even more important to make a strong impression because you don't have that space that you share physically. And I think now as we're moving more and more into this digital communication world, I think it's even more important that you show up with your authentic self, no?
Absolutely. Absolutely. You know, so what are some of the things that people have said to you? Excuse me. What are some of the things that people have said to you that stuck with you, that really made you see just how deeply and personal the journey of your smile is?
Oh, I have so many to say. I want to say that I have a story of, oh gosh, this is a weird one. This is a weird one. This is a weird one. But I love this patient so much. Like, I really get connected to my patients. Like, I am one of those doctors that I am like, I kind of take on the journey is also not just yours, but it's also mine, right? And I had this patient that came to do a consultation and came with the other half. And when we spoke about, you know, what the treatment goals would be, what I always like to listen to see, you know, what page are you on? Because I'm usually like, I have a long list of things to do that I want to do, but I want to make sure that I'm not trying to do too much, right? I want to fit within the budget. I want to fit within a timeline. And so we had that first meeting, and then they came with their other half. And when we met again, she said that when she went back, the other half really just didn't give any precedence to her own feelings and her own. And that's when she realized that she needed to leave that relationship because her teeth were really important to fixing. Yeah. And that happened. And so I was just, and then she came back again and she was just like, okay, I'm ready to start my journey. So it was that important that when someone made a decision that, hey, I want to do this for me, this is the decision that we usually ride with, you know? And a lot of the times people come to me to say, okay, I don't know what it's going to cost. I don't know what it's going to entail, but they just want to have an idea. And once they have an idea and they see what's possible, most of the times they're like, you know, this is a lot easier than I thought it was going to be. It was a lot less scary because we have a lot of anxiety and fear when it comes to going to the dentist because of pain, because of cost, because of not knowing, because of whatever situation we've made up in our head, because of what somebody told you about something, you know, or whatever you Googled. And so taking that first step is really it, because that's when you get the information, right? And I find that first interaction where you actually know what is possible is just whether you decide to do it now or 10 years time, it's just that first part of the journey, you know? So that's usually what happens. That's when I kind of get a gauge of where we are at. And that's how it has to begin.
You're a part of people's healing journeys.
Yes.
Really and truly.
I actually said that yesterday. That's interesting. I actually said that yesterday. We had in the clinic, we did so I have about 23 women on the team now. Yeah. And we had a long meeting yesterday. It's amazing. It's amazing. And I actually was trying to communicate how much of a privilege it is that we have the opportunity to impact people's lives. And that's exactly what I said. I said, we are healers in a way. And whether you are someone answering the phone, whether you're someone assisting, whether you're a dentist, we are all working together with the same goal and vision of trying to heal people's dental issues, but also their anxieties, which is a thing that I see all the time in the
all
clinic.
the time.
I always see it. I see people who are coming in and they're visibly shaking. Their palms are sweaty. They open their mouth and it's like, because it's flight and fright. And I know when I see that, I'm like, okay, this person really is being courageous here. They really want to get up and run away because that's what their body's telling me. And I have to treat that with utmost care and utmost respect. And I do.
Absolutely.
Like, cute things that we do. We have a pen that it's what delivers the anesthetic, and it times it. It's a digital pen actually, and it plays like classical music, you know. So it's like all these little things we do to try to combat and improve
ease attention.
The experience. Ease attention. Yeah. But it's one of those things that's just everywhere. Like dental anxiety is just one of those things I think will never ever go away.
Nah, and I mean, you're staying on top of your game to ensure that everybody, you know, comes in and, again, ease attention. But I want to bring this conversation to the business side because I think when it comes to the corporate world and the business space, we don't talk enough about our smiles, yet we all make the judgments. And the judgments on smile can cost either job opportunities or loss of revenue. Now, I want to give some stats, but then I'm going to ask you a question, right? I'm going to give a stat, then I'm going to ask you a question. So, employers are 45% more likely to hire someone with straight teeth, a healthy smile over an equally qualified candidate with dental issues. Now, why do you think our smile plays such a powerful role in the professional first impressions, even beyond what's on our resume?
Well, that your smile is sending a signal to that person that they can trust you, right? It's sending a signal that you look after your teeth. It's sending a signal that you care about how you show up. It's sending a signal that you can communicate well because you smile and everything looks good. And it's a signal of health. And that's a powerful thing in forming relationships. It's a powerful thing if you're in sales. It's a powerful thing in terms of getting people to focus on what's coming out of your mouth rather than getting distracted. Right?
Rather than just focusing on your mouth.
Correct. Yeah, correct. That was a good one. Correct. It is, right. And it's a powerful thing in terms of taking up that opportunity to make a good impression. So even in interviews as well, like, I mean, it's one of those things that you want to make a great impression. You want to signal that you can back up everything on your resume with your appearance, and appearance matters. It matters a great deal. Like a lot of these corporate places, you know, you have grooming standards, you have how you present yourself. So why not your smile? Because as I said, when you look at someone, it's 3 to 5 seconds, you make a judgment on if you're going to trust this person. And that is based on that eye connection, and it's based on this smile.
And I mean, that's huge when we're talking the business world and the corporate world. So next stat, 70% of executives say that they hesitate to promote an employee with visibly poor oral hygiene or chronic bad breath. Now, we have to dive into this.
Yes.
So, have you seen career-driven patients come in specifically because they were feeling held back professionally?
Yes, absolutely. I have actually seen people in leadership roles come in and say, you know, I just decided this is the time that this is going to happen. I have seen politicians. I have seen people in the media who's on TV. I have seen lots of people come in to say, hey, I'm ready to make this step because this is important for them to, you know, progress or send a signal that, hey, I'm looking cute. And it's one of those reasons, if you look at all those celebrities in the acting industry in Hollywood and the music industry, when they get far enough, they fix their teeth. Every single, you You find the
majority
outliers,
yeah,
right?
yeah.
You find the outliers, but the majority of them fix that because at the end of the day, it's going to get them more roles because they're going to deem more attractive. They're going to be deemed more trustworthy. They're going to be deemed more good looking. It's a thing.
Yeah. That being said, however, now, what do you say to the people who say, because I know you hear this all the time, it's just teeth. Like it's not going to deprive me of money or opportunities. It's just teeth. What do you say to those people? Because we see it all the time. Just wear your smile. J. Cole sang about it. Just wear your smile, right?
Yeah, it is. It is just teeth, and I get it. And there is actually, from me as a dentist, I will say there's no judgment. I don't go out there looking at people's teeth like, oh my God. I don't do it. Like, I don't say, wow. But I do, I think inherently at the back of my mind, I do, if I'm watching TV, I would diagnose, let's say, like a crossbite or a veneer that's not the same dimension on one side. Because it's just trained, right? So I have to train myself out to that. I will say that for me, dental health and cosmetic health, it goes hand in hand because from a functional point of view, when your teeth are aligned, your teeth connect together in a healthier way. So it prevents tooth wear, it prevents gum disease, it prevents cavities forming because plaque is not, getting removed easily with flossing. It prevents things like TMJ issues. Sometimes when you're stressed, and this is, a little segue here, I see a lot of patients who are incredibly stressed in their lives, whether it's personal lives or professional lives, and stress shows up in the mouth. People grind their teeth when they're stressed. People suffer from acid reflux when they're stressed. Acid reflux dissolves tooth structure. So the teeth become softer, they become worn more easily, and they become more sensitive. If you grind your teeth, again, it can become more sensitive, and then it can also lead to jaw joint issues like clicking, locking, discomfort with chewing, headaches. You can't sleep properly. It's like a long list of things that I see every single day in the clinic. And that's just stress, right? And it's more than how your teeth look. It's actually your well-being. It's being able to sleep with a good amount of sleep, with good quality sleep, And I don't want to bang on, because if I start talking about area dentistry, we're going to be here for a while, right? But it all ties into a healthy lifestyle. It all ties into, because when you sleep better, you think better. Cognitively, you perform better. When you sleep better, when you don't have stress in the mouth, you can chew, you can eat better, you can function better, your whole lifestyle is better, you know? And it's a very important component of health on its own, even mental health. When you're grinding your teeth, they're like, oh gosh, you're grinding. And then you're always on edge because you're like, I don't want to grind. My doctor told me not to grind. So it's all about trying to find solutions at the end of the day. It's trying to find whatever solution that would fit you, your lifestyle, your budget. It's about trying to find, maybe you can't find a long-term solution like Invisalign or veneers. Maybe you just want a short-term solution like a mouth guard or tooth whitening or a dental exam, just to kind of get an idea of what is possible. And, I think dentists have such an important role in improving lifestyles of patients. It's just really about making that decision to go visit your dentist,
Now, what about the people? I'm curious. I'm sure many people are curious. Do people come in and do they acknowledge whether they have bad breath or not?
Well, a lot of times you can't tell if you have bad breath or not, right? Because
I would say that if they've been told.
Yeah, so that's what I get a lot of. I get a lot of, hey, my husband sent me here, or my wife sent me here, right? Or some family member said, go see a dentist, and they come and they ask me about it, right? And the thing is, halitosis can be so multifactorial in terms of many different things can contribute to it, or one of many different things can contribute to it. And really and truly, you really need to have a full thorough assessment to try and find the etiology or the cause of it.
Yeah.
And that is going to be the thing that will point us into a good solution for it. So I know we live in a Google/ChatGPT mode. What I have, tell me some solutions. And that's all well and good, right? But really to have a thorough assessment, I think it's about choosing a very good dental practitioner to have an assessment, to really ask the right questions so that you don't have to be living your life trying to battle bad breath, because sometimes bad breath can be caused by certain bacteria that are going to persist in the mouth, and changing and modifying your oral flora is one of the more challenging or complex things to do, because it's such a complex thing, and we don't easily test for what bacteria it is causing this. You know what I mean? So it's really just about having a full thorough assessment so that all the data could be collected, whether it's through a scan, x-rays, photographs, a pH test in the mouth, and just asking your doctor, making sure you're open with all the information that you have to give. And then really trying to formulate a plan to nip it in the bud, to fix it so that it doesn't become a long-term issue.
So let me ask you this. Just how bad can halitosis get? Because when bad breath gets really bad, people talk about it, right? You'll have some people make a joke like that person could clear out the room. Like, how bad can halitosis get?
I mean, for dentists, I will say that we are trained, because we see this every day. There's certain types of conditions like periodontal disease that has a certain character of smell, right?
Wow. That's a great way of putting it. That is a great way of putting it.
It has a specific smell. And I know that if a patient is in the waiting room and I am in the kitchen, I can smell it, right?
That is crazy.
It is crazy. And it's a thing where if I'm in the bank and I am there and I can smell it. And so it's really about trying to get that, whatever issue it is, detected. Sometimes, it's an array of things. It could be acid reflux. It could be whatever medication you're on, and maybe you just need to switch your medication. It could be whatever diet you're trying. Sometimes you could get a ketogenic diet if it is you are, let's say, doing a keto diet, right? It could be diabetes. It could be so many different things. As I said at the beginning, it's multifactorial. And if it is that we're able to really thoroughly assess, take a really good medical history, trace every single thing that could be a problem. Sometimes it's just, like not eating on time. It's so many things that could cause bad breath. The most important thing is that we get to the root of the cause and we formulate a treatment plan and a strategy to move forward so that we could nip it in the bud so it doesn't become an issue, because it can really affect social interactions. It can really affect even
business interactions, your corporate
social interactions where, of course, you're going out, you're meeting random people, making friends, but also in the corporate space. It's
Absolutely. It's everywhere, and it's going to impact you. People are going to talk about it. Now,
correct.
I wanna switch over into talking about some of the biggest myths. So we're gonna do truth or myth, and we want you to break it down for us, okay? So I'm gonna ask you a question. You'll tell me. Yeah, you'll tell me if it's a myth or if it's true, and then you'll break it down for us, all right?
Okay.
So,
shoot.
First one is brushing harder will clean your teeth better? Will
Absolutely
brushing harder...
not. Brushing harder is not it. So brushing for a specific amount of time, which is 2.5 minutes, is what I usually recommend, with an extra soft or soft toothbrush is the way forward. Because if you brush harder, what's going to happen is you can damage the enamel, you can damage the gums, and you can actually cause trauma to these tissues, the hard tissues and the soft tissues. You can cause sensitivity, you can cause gum recession, and it's really just, I think I wrote once that hard toothbrushes are really just for clerks. That's, from popcorn, I think it is.
That's Vibes cartel.
Right. Yeah, exactly.
Okay.
On the topic of
Okay.
right. So that's the only time. And to be honest, there are patients that I would typically recommend to use a medium or hard toothbrush with, and those types of patients, the patient who really suffer with dexterity issues, and so they may not be able to whatever issues that they're suffering with their dexterity or mobility of their joints in their hands. That's when I'll say, okay, it's okay to use a harder toothbrush. But typically for the average person, extra soft or soft, and that's just because I want that we do as minimal dentistry as possible. We can maintain your teeth. We can maintain the gums, because you only have one set of teeth. And once you have your gums, you really only have that. So you really have to master it. And the type of dentistry that we try to do is a dentistry that will preserve and protect what you have, so that in like your 6th decade, your 7th decade, your 8th decade, if you make it past 90, we still have everything we had when we're 20, 30, 40, right? That is what we try to do. Because, I mean, yes, dentistry is in a place where there's just so many solutions for prosthetic teeth and bridges and dentures. And, we have these solutions, but let's try to avoid that. Let's try to adopt healthy habits. Let's try to nip things that can get worse.
Prevention is better than cure, as they say.
Always prevention.
So let me give you the next one. So you're going to tell me if it's truth or myth, right?
Right, ready.
Bad breath is always caused by poor brushing.
No, that is absolutely incorrect. It's frequently caused by certain types of plaque in the mouth and certain types of plaque being retained, but sometimes it is gastrointestinal issues that is, present on the tongue, or it could be caused by certain types of medication that you might be taking. It can be caused by so many different things. So it's not necessarily your oral hygiene. However, if you haven't seen a dentist in 6 months, then that's the best way to start. Because having a professional clean, even though you might have the best toothbrush, you might have the best oral hygiene routine, getting a professional clean, going underneath the gums, removing that bacteria that gets solidified, that can, hide away from the toothbrush, especially if you're not a daily flosser. It's so important to prevent things like bad breath. A lot of people go through their oral hygiene routine and miss the tongue. Like, there's no tongue left.
That's crazy.
And that's crazy because here's the thing. You're talking stats. 99% of the bacteria live on the surface of the tongue. The surface of the tongue is extremely large. I know it's very undulated. You have little papilla. You have bacteria goes everywhere. And if you think about it, if you were to just take a pencil or pen and make one dot on a piece of paper, that represents 1 million bacteria. If you are to see how much bacteria is in the mouth. So the mouth is full of bacteria. I'm not saying it's always bad bacteria, but what we're trying to do every time we clean is to reduce that bacterial load. So not just the flossing, but also the tongue scraping. Mouthwash, I have some... Do you have any questions for me on mouthwash? I have some unconventional views with mouthwash.
I'll get into that. I have 2 more myths, right? I have 2 more myths.
Go for it.
So the next one, the whiter the tongue, the badder the breath.
The whiter the tongue, the badder the breath.
Whiter, like when tongues are very white because people don't brush it?
White. Okay.
White, yeah.
Okay. I will say... No, because everybody's made up differently. And in our mouth, we have lots of, like, some people can make more protein deposits. We have lots of mucus being secreted by our glands. And sometimes people have different diets where they can retain whatever's being made in the mouth. They can retain that more than other people. So I will say... I haven't really heard this before, the whiter the tongue, the badder the breath, because it's not necessarily, I wouldn't say it's necessarily plaque, because our tongue is, if you clean it, you'll see that some of it is actually white. Some of it is naturally white. You know, we have a pink tongue, but yeah, naturally, if you were to exfoliate your tongue with a tongue scraper, you do have white bits on it. So I wouldn't say that. I would say that.
Yeah.
That's a myth.
Okay, that's cool because I guess that's one of the big myths that you see some people and their tongue is like pasty white. And you're like, oh. Yeah. I don't want to smell their breath.
No, well, it's not necessarily that. And sometimes people make plaque quicker. There's some people which, however their body chemistry is, they just manufacture plaque. And they might be scrubbing their tongue in the morning and the evening or scraping their tongue twice a day. So I would say it's usually a body chemistry, an anatomical, probably even a genetic thing. And I wouldn't want to say that it's correlated. I would disagree with that.
Okay. All right. So my fifth and final one is Invisalign only works for mild cases of misalignment.
Right. So I get so many patients that come and see me and say, well, I saw my dentist or orthodontist and they say Invisalign won't work, right? And what I will say in my hands, and I really don't like to make judgments on anyone else's opinion, right? Yeah. However, I just know that in my hands, I have been able to do some incredible transformations with Invisalign. And I think it's because with the amount of cases that I've treated, so I'm about to celebrate my 1,000th Invisalign case, which is an incredible milestone, or smilestone is what we're calling it, right? And it's actually because I've been really successful and very, I want to say lucky, but I've been putting in a lot of work in order to try to understand exactly what can be done, what can't be done, what other option we have if something can't be done. And it's really just trying to give that holistic treatment and experience to patients. So I will totally categorically disagree with that, because in my experience, I've been able to do some incredible things. And actually, a lot of my patients come to me because they've been told it can't work before and they just want to see what is possible. And it's one of those reasons I will always, I think for as long as I have a clinic open, offer free Invisalign consultations, because of the fact that there's so many misconceptions when it comes to Invisalign. And one person might have an experience and another person will have, and it's all different. And it really is such an individual thing. Everyone has different goals. People have different makeups. I will say that there are some cases, and I will probably say in my 6 years of doing dentistry in Trinidad, they're probably about under one hand, under 5 patients that I'm like, no, you need surgery, because of whether they would have had lots of rounds of orthodontic treatments, or they've just never done anything and things have just gotten worse. There are patients that I wouldn't put my head in block and say, like, I could treat everybody. I definitely would do that, because there are patients that I'm like, no, this needs more surgical intervention. But I would say that the majority of people that come to me that say, I was told that it can't work, and I look at it, I'm like, yep, we can do this. And with the technology that we use, and different things I would have way back in the day, even when I used to practice in the UK, that's when I think I did a lot of testing. I put my hands up. I would have made some mistakes when I just started. And that's when I go, okay, I definitely can't do this. This is a better way to approach it. And I have to really credit my mistakes for that, because now I know how to get to the end point. Yeah, of course.
The greatest teachers. Now, I want to switch over. I have a couple of questions, but I want to switch over to oral health and our physical health, because I don't when we think of health, we tend to think of our physical health, our body, but we never actually include our smile in that. We always talk about our mental health, right? But we never really
everybody
talk
talks about the mental health these days.
But we never really talk about our oral health, right? So let's start with, the basics. What actually happens in the mouth when someone neglects oral hygiene over time?
So what happens is that the type of bacteria that is present it matures and it changes. And if we're not cleaning, we're not removing plaque, then that plaque buildup can start deposits where you can't see it. So underneath the gums, in between the teeth, and they can cause things like gum disease. It can cause dental decay, and that's dental diseases, right? Mm-hmm. Then you have like cancer that is very prevalent, that can show up in the mouth. It can give us signs. There's oral cancers that can be detected. And since I've been in Trinidad, that's something that I've seen, that maybe when I was in the UK for like, let's say 11 years, I was working in the UK as a dentist. Yeah. Didn't see it that much. Like, I maybe saw 2 or 3 cases, but since I've been in Trinidad, I've seen oral cancer. And not necessarily they're appearing for the first time, typically as a metastasis, spreading from somewhere else. And things like that. Then if we were to go on to gastrointestinal issues, people who suffer with acid reflux, which might be an issue with the GI system, or it could just be stress-induced, or it could be as a side effect of a medication. This is another thing that we see, and it can cause people sensitivity, and you have them living on toothpaste to treat sensitivity as a norm, which I don't think should be the case. I don't think people should be living on. It's like you wake up every day, you put a plaster on. You wake up every day, you put it's just not the way to treat things, right? And I typically say with things like that, you have to listen to your body. You have to be aware. I tell my patients, if you go to the pharmacy, you buy one of those mirrors, and you have to help me as well do my job. You have to be aware. Most of the times when people come in and they're concerned, they'll be like, oh, what's this here? Like, I noticed this. Yeah. And I look at it and be like, hey, nothing to worry about. But it's those times when people see things and they're like, oh, I want to get this checked out, but it could be fit, it could just be not prioritizing it. And for me, like, being aware is one of the most important things. Listening to your body, listening to, I got a pain there, a pimple appeared on the gum, my tongue is looking weird in this area. I'm noticing a taste in my mouth. I notice bleeding when I brush or when I floss. I have a whole long list of things I can tell you. We could keep going, right? Yeah. But it's just really, really being aware of the mouth, and really, really being aware of what is changing, what looks different. Get one of those mirrors from the chemist. Have a look in the mouth. Stick your tongue up. Look underneath. And then, because we're not all dentists, and even though there's ChatGPT and Google, go to your dentist and tell them, right? Because you don't want to sit on something that you wish that you could have responded to or actioned earlier on. And then it becomes, a more serious, more advanced issue, which typically means more expensive, as well as limited options. Because the longer you leave things, the more progressed things get, and then our options reduce. And that is for anything in life.
That's where you don't want to be.
You could take that and apply it to anything in your life as well.
I have facts.
Sit on your problems, guys.
Now, gum disease is often talked about but rarely understood. So break down, what exactly is gum disease, and why is it more important than what people think or what they make it out to be?
So gum disease is one of those things, especially in Trinidad, in the Caribbean, that we don't tend to pay attention to. So screening for gum disease is so important, because gum disease can affect any age. It's not an age thing. And typically it affects the supporting structures of the teeth. So because it's called gum disease, a lot of people just think, oh, it's just my gums. But it's not. It's actually periodontal disease. It's actually the gums. It's the ligament that's supposed to hold the tooth in position in the jawbone. And it's actually the bone. So if gum disease progresses and we don't do anything about it, or you see a dentist, the dentist may diagnose it if they usually do screening processes with their checks. Yeah. If it is they do diagnose it, then they may decide to initially treat it, or they may decide to refer you to periodontist. I am very good friends with the periodontist that I refer to, and I don't take gum disease lightly, because the end result of gum disease is tooth loss. And tooth loss, the end result of that is not just needing like an implant that costs usually around the 20K per tooth mark,
Jesus.
but it's also losing your tooth is a very serious psychological thing. Losing your tooth,
Absolutely.
It's a part of you. But not only that, it can affect your bone structure. It can affect your facial symmetry, because if you lose a tooth, you'll find that, oh, now all of a sudden you don't want to eat on that side. You just want to eat on this side. Eating on one side of the mouth is like walking on one leg when you have a perfectly fine leg to walk on. So your jaw joints need to be being used equally. And if you are avoiding eating on one side because you've lost a tooth, then that can lead to so many other things. The other teeth can shift in that area. So basically, the end of this story is that we don't want you to lose your teeth. So gum disease is important to treat immediately. And actually, I think there's a percentage, don't quote me on this, but I think it's between the 80 to 90 mark of how many people experience a level of gum disease at some point in their life. And most of the time, it appears as a gingivitis, which is basically an inflammation of the gum. So if you're flossing and you're brushing, or you just poke the gum and it starts bleeding, that means that area is having an inflammatory response, and that is gingivitis. So gingivitis is the beginning of gum disease. Typically, it's accompanied with sometimes bad breath, sometimes pussiness, sometimes swollen gums, and that is an important thing to get treated, because we want to, as I said, nip it in the bud, prevent it from progressing. Because once you have gum disease, there is actually no cure for it. We just have to manage it and try and prevent it from getting to the tooth loss and the unstable parts of gum disease. Because once gum disease becomes unstable, it becomes incredibly difficult to manage.
Wow. Now, that being said, right, coming from gum disease, what are some of the things that happen within the oral health space that manifest into other problems? So think like, toothache leading to migraines. Like, what are some of those other ailments that stem from having bad oral health?
Well, if you are immunocompromised, the first thing that I think about is I see a lot of people that have stories with people who end up dying from a tooth infection. And that usually is sometimes if you are immunocompromised in some way or the other. So if you have an infection and you don't treat that, and let's say it's a chronic issue and it goes into your bloodstream, it can be a septicemia. Having said that, it's a very uncommon thing. I'm just saying that is what could happen, right? But other things that can happen is when your body's constantly fighting infection, whether it's a tooth infection or a gum infection or just a soft tissue infection, your body's put under strain. And what I always say is that we need our immune system, we need our bodies to be able to fight off all the other things that we come into contact with. So why not make your oral cavity, why not make your mouth healthy so that your immune system can be okay to fight off other things? So it's that. It's also, we see a lot of stress in the mouth as well. So you can clench, grind the teeth. You can lose the tooth structure and they can become shorter and shorter over time. And that can affect your jaw joint. That could then affect your posture. You might find that because of the clenching and grinding, yes, you get headaches. You might hold your head in this way. Then that leads to neck pain, back pain. And then that can trickle down your whole posture, how you walk, your quality of sleep, things like that. And also, I will say oral disease for me, right now, these days, I'm practicing a lot of airway dentistry. So that's really making space in the mouth for air to exchange easily, and also to discourage things like mouth breathing and snoring when you're sleeping, and encourage nasal breathing so that you can sleep with a high quality sleep. Because what we do know now is that if you're not sleeping properly through airway disease like snoring or mouth breathing, that can lead to issues later down the line that can affect your entire system. So your cardiovascular system, your breathing, your cognitive, like being able to remember things, Alzheimer's, dementia, all these things rely on having a good quality sleep. So something as simple as wearing a snore guard or an appliance which helps you to open up your airway because you can't breathe through your nose, that helps. Something as simple as adopting a nasal breathing regime to try to encourage you to breathe through your nose, or even further than that, nasal hygiene regime. A lot of people don't do nasal hygiene. So cleaning the nostrils, which usually gathers up dirt and dust, right? Doing that small thing can make such a difference to your breathing and therefore your quality of sleep. So all these things add up, and it's, for me, like when I treat patients, I'm treating all of these things. When I do my Invisalign treatment plans, I'm trying to treat your airway as well. So it's actually trickles down into everything, you know.
Now bring this back into just so I can bring it back home into a business context for people. Folks, when you do not get sleep and you have to get up and perform, do a presentation, maybe you have a big deal to close and you're heading into these meetings, these meetings, multi-million dollars on the table, and you're not getting the sleep, all of these things impact your performance, which impact whether, you get a job, whether you're earning money, losing money, these are all impact. But Dr. Shenilee, there has been and I'm going to admit on air that I've fallen for the trend only because it was just very easy to do.
Do not tell me about mouth taping. Are you going to tell me about mouth taping? Oh my goodness.
Hold on, wait. Oh God, no rush. So I was on TikTok scrolling through, and all of us, obviously since football player Ashton Hall came out with the clip to put on the nose and the mouth tape, all of a sudden my TikTok feed, especially because I'm in Asia now, I have TikTok shops. So I have a different TikTok than what we have in the Caribbean.
Right.
So because I have TikTok shop, when things go viral, you see them 24/7, right? Mm-hmm. And I was like, maybe I need to improve the quality of my sleep by just getting this nose thing and this mouth guard tape. So I ordered it, and I actually have it sitting downstairs to go and pick up. Now, I know you have done a video on, does this thing actually work? There are many people listening in right now that are thinking about the nose and the mouth tape, not just because they want to improve, the better quality of sleep, but because they're sleeping beside someone who keeps on hitting them an elbow, saying you're snoring, and we need to find a quick fix because you're not going to go to the dentist. Break down, does the mouth tape and nose thing, does it actually work?
So I categorically, absolutely do not recommend doing DIY medicine. I don't recommend it, man, because what it is that everybody is different. Everybody's anatomy is different. You might find that if you breathe in now, you try to breathe in through one nostril and the other, it's a different makeup because one nostril is functioning better than the other. You might suffer with airway disease. You might suffer with sinus issues, asthma, allergies. All these things give you a different profile. And treating it yourself or trying different things yourself, I think that's a little dangerous in my opinion, because your breathing, the oxygen exchange is super important, not just for, replenishing the functionality of all your organs, but it's important for that neurotransmitter regeneration when you're sleeping. So your ability to think cognitively the next day. And it's not just that one-off thing. This is something that's very additive. So it's the series of your sleeps that will contribute to your longevity, that will contribute to your risk of developing cognitive issues, cardiovascular issues, stroke. We always hear of, and what's very interesting is when I really got into airway dentistry, a lot of the stories surrounding the educators in this field, they themselves have personal issues where people that they loved passed away because they were on a CPAP machine or they were snoring and everything was fine with them. They would exercise, they would eat well, they would be relatively healthy.
Yeah.
And then because they're not sleeping properly, it predisposes them to stroke and things like that. So I wouldn't play with things like that. Like for me, I prefer to be safer rather than sorry. And if it is you go and you see your ENT or sleep physician or ENT consultant, and they're like, you know what, try the mouth tape. That's when I'll be like, yeah, man, do it. But I wouldn't do that, especially since people, if you actually think about airway and when you're sleeping, there are people who stop breathing when they're sleeping. They breathe in, they breathe out, and then they don't breathe in again till about 90 minutes. Get starved of oxygen.
Oh, you're dead. You're brain dead. That's it.
And so I'm not saying that that's going to happen, but I'm saying that it's
the potential is there.
You are taping your mouth. You are literally strangling yourself. Like, why are you doing that? Like, no, don't do it.
It's breathable. It's breathable tape. It's breathable.
No,
tape.
don't do it. Don't do it. Like, I think it's just, doing DIY things. And unless a doctor says, yes, try it, that's when I'll be like, well, you've been assessed. They've done a sleep study. They've checked these oxygen levels. They've checked this. They've checked that. And this is...
It could be solved with mouth. It could be solved with mouth tape. All right,
correct.
fair enough.
I would wait to do that. That is the advice that I would give. But I will say that breathing is an easy thing that you could DIY, right? We all need it. And if you were to go on YouTube and look at all the different breathing exercises, you will find that there's lots of different breathing exercises, and that I'm okay with you doing. Like that,
absolutely.
I can't argue with you. But you see, when you start taping your mouth, and that actually will affect your quality of sleep, that will affect different things. I think that's playing with fire, in my opinion.
All right, fair enough. Now, Shenilee, as we look to wrap up, every single year there's a special day or a special month on the calendar. What is the Smiling Special Month?
Oh my goodness.
What's the Smiling Special Month?
Okay,
and
so
what happens
August,
during this time period?
It's August, and it's August the 8th, 9th, and 10th this year-ish, like around that time. Mm-hmm. We are planning to celebrate our 1000th Invisalign Smile, and we are doing a special Invisalign Day, and we haven't released the time slots or the dates specifically yet, but that is the timeline. And I will say that it's one of those times that, we do this as almost like a give back to also celebrate our milestone and our successes with treating smiles. We usually do some serious discounts. This year, we are doing something really, really special. So we're actually going to gift an Invisalign treatment to someone who shows up and signs up. We're going to do 100% back. We're going to do like a special draw.
You hear that, folks? You hear that? Yes. She's giving away an Invisalign treatment, 100% off. Continue.
Correct. And also it's a day of education, of also knowing what is possible. So usually every year we do it. Last year was really, really fire. We really did amazing job at just celebrating in general. So that was our big Invisalign Day. And this year we're going to do it again. But with how I do things, I always try to do things bigger and better. Like I'm just not content with mediocre ever. So it's going to be really special. And because we're celebrating a milestone, you see what I did there, right?
Milestone, I love it.
Because of that, we're going to be doing lots of giveaways and also just really having fun with the whole education process. And I am big on letting people know exactly what's going on. And so for this whole month and next month, we're doing that preliminary screening to see if you'd be a candidate for that. We're doing free or complimentary Invisalign scans where you get an Invisalign assessment, and we do virtual appointments as well. So if it is if you don't have the time to come in for a full hour for the assessment, you can come in, get the scan done. It takes like 15 minutes, and then we can do a virtual call and talk about what the options would be in terms of cost and things like that. And a lot of people are very anxious when it comes to cost. We do payment plans, we do interest-free payment plans. So we really try to make it accessible, because that's one of the things that, when I learned about the barriers to dentistry, we have the traditional anxiety and the fear, but there's also cost, there's also pain, and there's also a cohort of people that think it won't work for them or think that they won't be disciplined. But you'd be surprised once you start to get the conversation going, and once you make that decision, it usually follows through with success.
So give me those dates again, the potential dates for people to look out for.
Right now, we're trying to decide. It might be, I think if I'm going to wager on it, I think it's definitely going to be the 9th of August, because that's a Saturday and that's the day when everyone can come.
Okay, folks, keep that in mind, and we're gonna get your handles just now. But Shenilee, as we look to wrap up, for the people that are in the corporate space, in the business world, that are thinking about their smile, they haven't made the decision yet. They're not confident. They're feeling insecure. You can tell they're insecure. They know they're insecure. They're hiding their hands. Talk to those people who are feeling that nudge, that something needs to change, and it starts with their smile, and it's impacting business, it's impacting the corporate world. Talk to those people as we close out.
So I will start off by saying that in that realm, your smile is kind of like a non-verbal handshake, And I do believe that everyone deserves to have and live in their best smile. I think your smile is your confidence. And I think that everyone deserves to have that confident smile that they've always wanted. I think it's almost like your business card. This is your logo. This is what you're presenting to other people. And I think it's down to, just taking that first step, taking that decision, having that moment where you decide that you want to have a breakthrough, that you want to make a decision to improve yourself. I think it's just that. And it's more than just cosmetic, it's your health as well. And it's your well-being.
I love it. Dr. Shenilee, where can the Freedom 106.5 family find you and Smile In online?
So we have our website, is smileanddental.com. We have Instagram handles. My name is Dr. Shenilee, and Smile In TT is the Instagram handle for Smile In. And we're on LinkedIn, exactly as that. We're on Facebook. We're on TikTok as well. So we are, and even if you just go in Google and you type in Smile In has two N's, we're on Google. So I think we've really been, I'm so proud of our team. We have been evolving, we have been improving, and we just keep getting better and better. And I'm just excited for every single person that walks in that door, because I know that we're going to make a difference.
Ladies and gentlemen, please give it up for Dr. Shenilee Hazell of Smile In. This was definitely an insightful conversation. Again, a lot of things we think we just don't have these open conversations about. And we were able to see, how your smile impacts a multitude of different areas of our life, and some really important ones, like our personal lives, our romantic relationships, our relationships with people, and what happens in the boardrooms and in the business meetings. So thank you for coming on the show.
Thank you so much for having me. Thank you so much for this opportunity. I enjoy your conversations as usual. And thank you so much to everyone who has listened and given me the gift of your time. That's something I feel really privileged to have. So thank you so much.
The best insight, instant feedback, accountability. The all-new Talk Radio Freedom 106.5.
I hope you enjoyed that episode with Dr. Shenilee Hazell of Smile In. Link to her contacts and socials will be in the show notes as well. If you enjoyed today's episode, don't forget to like and rate the podcast. So if you're listening on Apple Podcasts, Spotify, YouTube, like the podcast, drop your reviews, right? The reviews also help to grow the podcast all over the world. So I don't ask for much, but drop your comments on YouTube. Drop your reviews on YouTube, on Spotify, on Apple Podcasts. Again, these are the little things that you guys can do to help your boy out and support the podcast to continue to soaring new heights. That way we can continue to give you the content that helps you to elevate and tap into all of the opportunities that the digital world has to offer. That being said, learn more about building your digital presence and learning how to monetize your platforms at KarenRose.com. Stay up to date with all things happening with the podcast at digipreneur.fm, the website. That is it from me today. I'm going to see you guys and gals and lovely ladies, all my fellow digipreneurs. We really got to build that digipreneur community. My fellow digipreneurs, I'll see you later this week. Take care.
You've been listening to the Digiboss, Karen Rose. We hope your notepad was filled after this episode. Make sure to like, rate, and review the show. The learning doesn't stop, folks. And to make sure you don't miss any gems from the Digiboss, go over and follow him on all social media platforms at Karen Rose. Folks, don't just sit there with a notepad. We need you to implement at least one thing into your business before the next episode. That's the only way your business levels up. Thanks for listening to Digipreneur FM. Now go be great.